how ACCD is, we're live, how ACCD is affected in 703. I don't know if you have any pieces in 642 at all, do you? The arts and culture bill, do you have any pieces in there?
We might be named in there.
They didn't invite you in at all on 642?
No, and nor on 703.
Sort of strikes me as similar to the VITA program, except it's a major carve out for the arts and culture. They put 17.5 billion in that, and we only put 20 million for the whole economy. They have 17.5 for that, and nothing for any other business at this point. So anyhow, welcome. Why don't you walk us through, Jessica just told us that you're impacted in section 4 and on the last pages of the bill. So let's talk.
Yes, that's great. There's only 2 sections, section 4 and section 46, I believe. So in a way, this is really almost like the first time we're reading it. We were not asked in on any of those sections. So, oh, sorry. On the technical assistance provision for BIPOC-owned businesses, right now, currently, the administration is working on the BIPOC business convening, which was mandated in last year's session, and I believe was just kicked off. Curtis Reed is the contractor for the state. And I believe the idea and the process was going to be, once there are findings and actions that we need to take, that convening group, that contractor will put together the ideas about how we could best serve the BIPOC community. So I'm not sure how this ended up in there. This might have been put in as an advance. I'm not sure. We were not asked about it, and it was not in the governor's proposed budget.
Yes, go ahead.
So Joan, I mean, I don't want to speak for the committee on how this might have gotten in there, but I mean, I think while Curtis was gathering his, marshaling his forces to do his work, other organizations like the Professionals of Color Network really started filling huge gaps. I mean, just tremendous gaps, as you know. So I don't know that it's fair to say, like, I'm not sure why this is in here just because, and you weren't invited to testify. So I get it, but, this needs to happen anyway, even if Curtis's report isn't ready. There are other organizations that are doing the things specifically listed here, and they're really necessary as dollars fly around and as people try to recover and switch tracks or switch careers. I wish we had time for findings and studies, but that I think what I'm struggling with is why that work was so delayed. And if that's the case, that we can't help that, but we have to help people today. So I'd be happy if you wanted to respond to that, but I don't want it to go unsaid. Like, this is important, and it's not about, like, I don't know why this is in here. Like, it needs to happen. People need help.
No, I understand that, and I appreciate that. It's just that we're named as the contract. We will contract that out. So it's just a question of, who would we contract it out to? Does this happen concurrently with Curtis's work? What is the path, and how should we best do it? Or are we saying the urgency is so intense that it doesn't matter about how it gets organized? I don't know. Again, I didn't know the context, so I can't speak to it.
Right.
So
the group that they had in was the Professionals of Color Network in the state,
right,
which is doing this work and is doing it without any support from the state right now. So I think what we're receiving as well, that is a little bit new for me at least, is that appropriations worried about naming too many organizations directly in the budget. But I do think the intention here was to give it to the one group I am aware of that's doing this statewide and has far communication reach right now and is engaged in these activities.
So Senator Robb, do you know whether this was put in by Commerce or the Appropriations Committee?
Commerce.
Commerce.
believe it was reduced the appropriations and the name of the organization was taken out. That's what.
So I'm just refreshing my memory. Last year, didn't we put 150,000 towards goals similar to this? And you're saying that it's just not happened yet, and the appropriations committee wants to advance it to happen more?
Yes, I mean, I guess how I would characterize it is it's unfortunate that that work took so long, because I think we could be looking at findings and recommendations now and appropriating more, knowing how many millions of dollars are going out the door right now. That work has, Joan could probably speak better to, like, I don't think that work is close to complete. And at the same time that that work was on a parallel track, the Vermont Professionals of Color Network really just did the work because it couldn't wait.
So you were waiting, essentially, it was waiting for work that the Curtis Reeves organization was supposed to do. And what's the status of that?
That's a great question.
It's just beginning. My understanding is that the contracting process held it up, but I heard that there's a first convening on Friday.
So they just left the contract of what was approved last year?
Yes, that's correct.
And what precisely was it that was supposed to be done?
It's really a convening so that the BIPOC business community could communicate what is necessary, like what type of assistance, I believe. And I don't have the language right in front of me, but it was that the administration, through Division of Racial Equity, will, I forgot how it was worded, but something like they were going to do the contracting with the assistance from ACCD. So that process just completed. I think it took a long time, as all state contracting does. It took a long time to get the contracting in place, and I believe he's starting the first convening this week.
So now we're spending $150 to convene an analysis that we have some information that some organization has already done.
My understanding is that the professional people of color network has begun this work. I am not a party to that information. I have not received any report, or I don't know whether it's in process, but that is exactly as Senator Rahm has portrayed. That exactly what I heard, that they had begun that work.
And presumably there's been testimony in the House to that effect?
Well, when we say that work, I don't want to confuse a report about like how to help BIPOC businesses with helping BIPOC businesses. So the Professionals of Color Network started helping BIPOC businesses in material ways, helping entrepreneurs, career fairs, people who want to break into markets, mentorship. So
has there been testimony in the House?
Yes, by Wei. I believe who's been in this committee once last year. But yeah, she's one of the leaders of the Professionals of Color Network.
And
I could give a little bit of context, if that's okay.
Because you were there for.
Yeah.
sure.
So sorry, Jess
for the
Ventnor.
record.
Yeah, so Jess Ventnor with the Agency of Commerce. So last year, and I apologize, I'm not sure which organization produced a survey, but there was a survey produced, I believe it was Curtis Reed's organization. And some of the results of that survey I don't think it was surprising necessarily to anyone, but I think it showed that the representation in chambers of commerce for BIPOC businesses was incredibly disproportionate to white-owned businesses. And so when the survey was presented, there was this conversation about, well, do we create a BIPOC chamber of commerce? Do we do this? Do we create a department within the Agency of Commerce? And so I think House Commerce said, and I'm like paraphrasing here, so I don't think anyone necessarily said it, but they said, let's contract some money or give ACCD some money to contract with someone to ask BIPOC businesses what they want and what they need. Do you want a chamber of commerce? Do you want a department at the Agency of Commerce? Like what is what is it that you need and what is it that you want? And so the convenings are with BIPOC business leaders, BIPOC organizations. That's what Curtis Reed is doing in the next 2 days. The agency will be involved in those. There'll be a series of them. They were supposed to happen by, I think, January 15th was a preliminary report, but the final report was always due in June. So there will be a report that Curtis's group, because that he is the one who we're contracting with, will produce.
But what's the $250,000 for?
So this is for, I believe that this is for ACCD to contract with an entity to provide direct business advising right now, as Senator Roth pointed out. And so we did not testify on the section.
Did not.
But I
So
hope that just provides a little bit of
ACCD
context.
did
of how
not
we do it.
testify for or against?
No.
Correct.
Well, I'm just thinking, and my question is, if we paid $150,000 to what, do a report that would tell us what's needed
That was the
according to the
intent.
report?
Yes, and that was the intent. I think from ACCD's perspective, we wouldn't have been able just to create some type of entity within state government that would able to serve this population without knowing what it is that they needed or what it is that they, what BIPOC businesses need, whether it be financial help or
ACCD
technical
is
assistance
charged
or.
in this particular section with spending the $150,000 to contract. On what basis would you wait to get the results of the $150,000 study to tell you what to do before you did it? Or would you move ahead on the basis of this language?
We would probably prefer to wait for the study, only because I'm not sure what we would do, whether that is the finding, like whether that's going to be the find. It's almost as if there's an assumption being made that the finding is that their technical assistance is necessary and we need to, contract somebody out. So it does feel like it's not in order, but I understand, as Senator Ramos said, there is urgency and this did take a long time, but yeah, I'm not sure, like if we didn't get the findings report and we got this technical assistance money appropriated, we would have to go out and contract again for that. And maybe along the way, the report would be ready. I don't know. I don't know the timing
What
and the
technical
ETA.
assistance to provide?
Sorry?
Would you know what technical assistance to provide?
I mean, so if I could just say, so a couple things. One, I think it's really unfortunate that the study is taking this long. I think what you've seen is a lot of the same people who stood up access clinics in the pandemic for, vaccines and COVID help for communities that were left behind were some of the same people building the infrastructure to help businesses that are falling through the cracks. So if we can agree that there is urgent need, then I hope we can sort of make the leap to how challenging it would be to wait for this study to be done. The second piece I want to say is that what they are doing that deserves some funding of all the millions of dollars we're spending in the Professionals of Color Network can inform this study still. They can say, we're learning that, this is working, this isn't working, we're not able to reach this county, we're struggling with supporting people in this language. There's still information to be gathered, but ACCD doesn't even know who this organization is. And that's frightening to me because this is the only organization truly helping BIPOC businesses, probably alongside informally AALV. But, I can't wait for this because these are businesses that need help right now, and
My
ACCD
concern
should know
is-
who they are and be
My
supporting
concern
them
is we
already.
should know who
We should.
and we've had no testimony, at least in this committee, that tells us that this makes any sense at all.
Okay,
Can we get 150,000 back?
that's my bigger question.
I mean, if we know what we want to do right now and there's urgency to it, why study it? Probably not. We signed the contract, right?
Well, like you said, I believe I've seen the advertising for the sessions that the organization, Curtis Reed's organization, has planned, and I think they're imminent, aren't they?
Yeah. so-
Yes, they are imminent.
I'm not sure if you can claw the money back, but
Right.
my concern is the money going to be just totally wasted?
I think there was discussion in the House about clawing the money back, but the way that it ended up happening, and I would defer to Susanna. The RFP and the contract was signed through her office and through BGS. Was
I would
just
say
within
partially
days.
facetious.
Right.
Oh, yeah, no, but within days, the contract was signed. Quite literally within days of that conversation, the contract was signed, and moving forward. So they did talk about it.
We seem to be faced, this is admittedly a slightly different situation. I think this is the third time I've seen implementation before study results in bills we've had. We had the birthing center bill, we had some other place too where it's, anyhow, we should get the language from last year distributed anyhow.
And I think, the leaders of the Professionals of Color Network would be great to have in if we have time for that. They don't know what we're doing here. They just started doing the work that's needed, and I think we should fund it. And I'm sorry that we lost $150,000.
As I say, I don't know what we're funding. I don't know who we're funding it to.
The work that they're doing, business coaching and other forms of training.
We're funding something that has some equivalency to a business network or a chamber that does not exist directly focused on people of color, right? So we help the Center for Women in Enterprise. Curtis Reed's operation is not the same as the Center for Women in Enterprise. This is now
That's an independent business.
it's an independent consulting business, and this is a specific effort, the first in the state, focused on professionals of color and helping entrepreneurs, businesses, and people who want to network around their careers.
What is, I have written down here, Linda Ross and the SBA. Does they have any involvement in this?
That's the Small Business Development Center and the professional network of people of color is part of that navigator. There's a SBA navigator model that SBDC has been appointed the hub, and there are other spokes, and they are one of the organizations in the network meant to provide technical assistance to businesses throughout the state.
Maybe we should have the professional persons of color network and the SBA in briefly to talk about this section.
Yeah.
Because it is, and we should also get the language from last year.
I just-
So remember, we worked on that, and we fought hard to make sure that happened last year.
Right.
So where was the delay, Commissioner? Why
It was in contracting. I mean, the way the language was written, ACCD was to assist, but the actual selection process and all was out of the administration, AOA, through the Division of Racial Equity. And, I don't know how often you've worked with us on contracts, but it's a long lead time. And we could talk about why that is and bottlenecks, but there was a bottleneck.
So to find out more, if we wanted to, with her name, Joanna Davis, would she know? Do you think?
Yes,
So that could-
yeah, she was directly involved.
Contract ended.
Yeah.
Could you be willing, Jessica, to find out more about that? Call
Yeah,
her,
so
call her and say, where was the delay?
would
It
you,
just seems a lot of things get delayed.
so she did testify in the Commerce Committee
She did.
about the delay.
Yeah.
So would you like me to connect her with Scott? Do you want to hear from her or just?
Could you ask her if she could just send us some info
Sure.
as to what happened? What she thinks the delay was caused by.
So there's testimony in Commerce though from her office. Actually,
Yeah.
Not on this
You too.
exact piece, but we did.
Right. And just, given that House Commerce originated both, proposals, we could either have, someone in that committee speak to this informally or something, but I think they even, having had the original idea, felt compelled that,
And how much did they put in originally? Do you know? They put $500,000?
I believe it was $500,000. I can double check, but that's what I believe. Yes, and I think I text to that effect.
Okay, let's go to the last section of the bill.
So the last section, 46, I think it has us retaining 8 million, and then in July going to JFC to guess tell them how much residual funds we have on the economic recovery grants, but with the ultimate goal of returning it to the state fiscal recovery fund, ARPA bucket of money.
So $8 million of the 30, right? Is that the starting point, 30?
Again, we weren't asked to testify on this, but I think that it came from the idea that we have at least, we have a little less than 26 million residual funds.
Right.
So I don't know what went into the determination of 8 versus the rest of the residual. But that's how they broke it down.
You never testified in this section either, right?
No.
So this probably was put in by the appropriations committee, how they.
Yeah,
reallocated the
probably.
money. I can't remember where the 8 came from. It seems like they're both. They both go to the same place.
They both go to the same place, just that one looks like,
The creative economy.
Yeah.
And that program is practically on pause, or it's
not on pause. It's not on pause. I mean, I approved an application last week, like it's not on pause. There are people who are still, it's just a trickle, let's put it that way. And so by statute, we can't close it down or pause it.
Right.
The way the statute read was until the funds are expended. The way that you all did the H-159, where I believe you had it reverting to capital investment, seemed like a cleaner way to do it, as well as in accordance with the original language. But yeah, I don't know. There was probably another use for the funds, and that's where it ended up.
I see what the House did. They put 17.5
Right.
creative economy, which left $8 million left over for
Right.
Of the 25.5 that everybody seems to be using, as opposed to 26, but 25.5, and so they felt they hadn't spent $8 million for sure. I guess if the creative economy doesn't go through at 17.5, there may be even more of offer funds out there. Okay. Thank you.
Thanks.
Yes, and we have to move on to healthcare, I think. Appreciate you coming in, and
Bye-bye.
stay tuned, okay?
All right. Bye.
Our next witness is, let me get my agenda here, is Anna Backus, Director of Healthcare Reform at AHS. Probably have a few sections in this bill. I think I have a meeting with Senator Lyons at lunch to tell me some more about this or what's not in here. But good morning, welcome, and could you introduce yourself and direct us to the sections that are in 703 that are of interest to help the Healthcare Reform Office.
Yes, absolutely. Good morning. Thank you for having me. My name is Ina Backus. I'm the Director of Healthcare Reform in the Agency of Human Services. And I'm happy to just walk through my comments, or I can share my screen so that you can see where we have comment. It's your call.
We have hard copies of the bill in front of us. If you could just tell us what section you're talking about, we can see your face that way.
Okay. By way of background, the Director of Healthcare Reform in the Agency of Human Services is responsible to develop, update, and maintain the healthcare workforce development strategic plan. And I wanted to share that with the committee so that you understood that there are quite a number of activities as described in H703 that are reflections of recommendations from the Healthcare Workforce Development Strategic Plan. And that strategic plan is, it is developed with the input of an advisory group. And the strategic plan is also presented to and approved by the Green Mountain Care Board. And we went through that process in late 2021. The strategic plan has a number of areas of recommendations broadly about the healthcare workforce and healthcare workforce development. And we also included some framing in that plan so that we could align healthcare workforce development activities more clearly with the State Workforce Development Board. And I'm very pleased that we are now working as an official subcommittee of the State Workforce Development Board. So the Healthcare Workforce Development Strategic Plan Advisory Group is formally connected to the broader Workforce Development Board in the state, which is very exciting and is a new development of that plan. The plan has a number of recommendations around financial incentives, education and training, recruitment and retention, and regulatory reforms that, again, I think you'll see reflected in part in H703. Speaking specifically to the sections in the bill, I'll start with providing feedback on section 20, which is emergency grants to support nurse, faculty, and staff. Here, we recommend that these emergency grants would be provided directly to the schools themselves or through an alternative administrator other than the Agency of Human Services, as our capacity for administering grants of this kind is limited. Similarly, in section 21, we provided this feedback.
Before you go on, so your point there is, I think the way it reads, it seems to provide direct grants over 3 years directly to the persons to. Goes to the Department of Health.
Correct.
Are you part of the Department of Health, healthcare reform?
The agency of Human Services, as you know, has the 6 departments: the Department of Health, Department of Aging, Independent Living, Corrections, Department of Vermont Health Access. The Office of Healthcare Reform sits at the Agency of Human Services in the Secretary's office.
Okay, so do you have an issue of this $3 million going to the Department of Health and then contracting out to the nursing schools or granting money to the nursing schools?
That's correct. I can reflect the Department of Health in my comments as I'm speaking on behalf of the agency and its departments. Yes, we would prefer, the Agency of Human Services and the Department of Health would prefer that these grants be directed to the schools themselves rather than administered through the Agency of Human Services and the Department of Health specifically.
So then I guess in that case, what we're saying is that the Agency of Administration would sign the contracts with the nursing, or it's not a contract, it's a grant. So we don't want to be in the middle. We just want to go directly to the nursing schools.
Correct.
Is there any proportionality in terms of how much each school gets? Is that set forth in the section, or that would be determined whoever is distributed? It's, oh yeah, based on each school's proportion of nursing faculty. Okay. So basically, just so I'm clear, on section 20, your only comment is you want the money to go directly to the schools as opposed to going through AHS.
That's correct.
And do you have any history in terms of why it was done this way? Were you consulted? Did you object when this was put in this way?
I don't have the history for why it was put in that way. We did consult with Representative Jerome in the House, the Commerce Committee, and we shared the same feedback that we're sharing with you now.
Okay. Seems like, and so you don't know why, okay. Seems like there's a lot in this bill where people don't know why they're in here.
Or it doesn't belong to us.
Yeah. Okay, let's go on to the next section. Thank you.
So our comment for section 20, for the section 21 that involves the grants is the same as in section 20. We would prefer that these dollars be directed to the hospitals themselves rather than passing through the Agency of Human Services as a grant administrator. So our comment is the same there. I also would point out in terms of the work group that the Director of Healthcare Reform is charged with in this section, that the Healthcare Workforce Development Strategic Plan did recommend that the Office of Professional Regulation facilitate a work group between the schools of nursing and clinical sites, as well as healthcare organizations, in order to establish a preceptor model of clinical training and to maximize opportunities for student nurses to obtain their required clinical time. And that this work group is active and is convening now with the Office of Professional Regulation as the facilitator. And so my comment here is, I think that we could consider, certainly at the very least in this work, we would want to consider the work that had happened to date through the group that the Office of Professional Regulation is facilitating.
You made the same comment to the House and they didn't accept it?
We commented primarily regarding the grants, and we indicated that that this activity in particular would be one that we can conduct this work, but since the OPR group is convening and is being facilitated, we think it would be important to understand where they arrive in their work and take that up in this work.
Did you provide them with anything in writing summarizing your recommendations?
We did not. We met.
I wonder if you could provide us with something in writing summarizing your recommendations.
Absolutely. I will share the document that I am reading from.
Thank you.
Thank you. Okay, so on this part, you want the contracts directly to be with the hospitals, and you want any kind of working group in this regard to take into account what OPR is already doing. And perhaps they should lead it if that's the way something.
Correct.
Okay.
In section, if you're comfortable, I'll move now to our feedback on section 23.
Okay, you don't have anything in 22? Okay. Okay, 23, okay.
Section 23, here in this section, I want to emphasize that the governor's budget proposed $3 million in funding for nurse scholarships, and that this nursing forgiveness incentive program has an appropriation for only $100,000. We support scholarship funding in the amount that was proposed in the governor's budget, which again is $3 million for funding nurse scholarships.
This forgivable loan program is another way of saying scholarships.
That is correct. Yes.
I have some notes here that said there may be I don't know if it's this section, but is there some carry forward money here that is part of the reason why the House may have cut it down?
That is my understanding. Yes. And I think that we've seen success with this scholarship program in previous years since it was established. The scholarship program for nurses does have a requirement that nurses work in Vermont for a minimum of 1 year following licensure, and has since this program was established, I believe in 2020. When scholarships were offered through the state colleges directly, those scholarships did not have a requirement for a service requirement or a minimum amount of services associated with them. And that may be a factor in why there's carry forward in this scholarship program, in that with the options for scholarships that had no strings versus these scholarships, which do have, I think, a very important requirement for service, that there may have been more uptake of those scholarships with no strings attached. But as we move forward, I think it's very important in certainly in building our nurse workforce for the future, and also including an incentive to work and provide service in the state of Vermont, that we fully fund the scholarship program, again, consistent with what the proposal from the governor.
Okay, so you want $3 million for the forgivable loan program on top of, I don't know if it's the right amount, $1.8 million left. Does the $1.8 million, if that's the right number, does that have the strings of that pot of money of working for a year in Vermont to get that scholarship money?
Yes, that is my understanding, that is the same, yes, scholarship program, again, created in 2020.
Okay.
Yes.
Okay, got it. Question?
I mean, I don't know if it's a question. I mean, I was just looking back at the preceptor section now that we're talking about the money going directly to the hospitals. And when I don't, maybe this has already come up, but when I read that the agency or somebody's distributing funds to the hospitals at a rate of $5 per hour, I don't see where it says that preceptor gets the money. It just says that the hospital gets reimbursed at that level. So I think I had assumed that, I don't even know if this is a question for Ina, but
Is this section 23?
it's in 21 because Ina was saying we don't want the money to go through us.
Right.
So I guess that put me down a rabbit hole of like, what if we give the money directly to the hospitals? Maybe this was already an issue before. So if you saw a puzzled look on my face, section 21 concerns me because we're giving money to the hospitals, but it's not, and it says the rate is $5 per preceptor hour, but it doesn't say that person gets them $5 per hour. So
you just tighten it up to make sure it gets where it's intended as opposed to
the person providing the
$5 though would be subject to taxes and withholdings, wouldn't it?
Right, I just want to, it doesn't say anything about like subject to, it says that subject to collective bargaining or impact bargaining, but it just says the money goes to the hospital.
And that would be maybe a reason to run it through.
Yeah, so I started looking at that section like, oh, is it okay if it just goes directly to the hospitals? And then I got concerned about the whole section, so.
It's a good point. Probably one Ina doesn't want to hear, but.
And I think that there's also other potential avenues for it to be administered, potentially. I don't know if it's an avenue or not, but, through VSAC or another administrative entity, for instance. I think our chief concern is with our capacity to administer grant programs being, being limited.
Regardless of who it's routed through, whether it's direct or routed through a third party, the issues of union representation and the issue of how the money gets to the individual, whether that the individual could accept it from a third party while being employed by a hospital, I think is a real question. The notion of it being paid by the hospital is, instinctively, it seems to be the right answer as opposed to getting someone else involved, provided we just have clarity as to, is this something that's going to be meaningful to the individual receiving it to encourage them to engage in preceptorships?
So let's ask
Yeah.
that basic question of you. If you think this is a worthwhile investment, is this an area where some of the pipeline is like, or the supply chain in some ways is suffering?
This proposal was we did not put this proposal forward as a part of the governor's budget, nor, we proposed in the healthcare workforce development strategic plan, as I referenced, we thought that a work group should be informing a model for preceptorship in the state. I don't feel qualified, based on those aspects to necessarily speak directly to this proposal here.
So it could be a problem that needs to be studied before we put the investment in it, is what you're saying?
That's not necessarily what I'm suggesting either. My suggestion is simply around the funding mechanism here. And I think that, again, the Agency of Human Services has limited capacity for administering and running grant programs. And so that's where I'm really emphasizing an alternative there, not commenting necessarily on the content itself.
So now that we're back in section 21, does the 2.4 million come from the governor, or is that in his budget at all?
I'm sorry, let me just make sure I go back to the same place.
Section 21, nurse preceptor incentive grants. It says fiscal year 23, the amount of 2.4 million is appropriated from the general fund to provide incentive grants to hospital employed nurses.
That was not included in the budget.
Is this put in by, do you know if this is put in by Commerce or by probably the healthcare committee, right?
I believe that there was a working group comprised of members of each committee.
Right, I think we heard that, including appropriations. Yeah. Okay. Let's move on. We've got about 5 minutes.
Moving now to sections 26 through 29. These sections establish a combination of loan repayment programs and forgivable loan programs. I think it's important to differentiate between those two. I routinely am confused by the language. The forgivable loan programs are scholarship programs. That's how I differentiate them, while the loan repayment programs are just that, loan repayment programs. But I was finding myself routinely kind of caught up between the forgivable loan and the loan repayment and the difference between the two. So I find it helpful to remind myself that scholarships are forgivable loans. And I understand that there's some technicality around there that's important, but it helps me keep things straight. So with respect to sections 26 to 29. The governor's budget proposed $2 million to support nurse loan repayment specifically, and AHS supports this amount for nurses. In these sections, that loan repayment program, as you know, was combined with also a physician assistant loan repayment program. Further, the Department of Health already, it does operate a loan repayment program today for healthcare professionals, which includes nurses and physicians assistants. And so there's just a question about whether a new loan repayment program needs to be established, or instead we could build on the program operating today with the Department of Health.
That's the AHAC program, right?
The Department of Health receives the appropriation, and it works with AHAC in order to administer that program. But the Department of Health has the charge for fulfilling the loan repayment program.
Now that program, does that include both nurses and PAs or just nurses?
My knowledge of the program is that it does include nurses and PAs, yes.
Okay, thank you.
Again, the governor's budget proposed $2 million in loan repayment to support nurses specifically. We also, in these sections, section 26 to 29, would recommend consideration for combining the funds into one loan repayment program inclusive of nurses, physicians assistants, and nurse faculty for ease of administration and clarity.
Yep. What did they appropriate total for the three groups? See, 500 for the faculty. Can you tell me what the House put in terms of money for the nurses and the PAs? Looks like they put $2 million total for both the nursing and physician assistants. And you
That's
had
correct.
suggested $2 million just for nursing. Did you suggest anything for nurse faculty at all?
We did not. We would suggest that nurse educators could be included in that nurse loan repayment program.
Okay. Where do we go next? Are we done?
That's it for us. Again, I think here in these sections 26 to 29, there's a combining of the loan forgiveness and the loan repayment programs that may be better administered if they are split into scholarship programs and loan repayment programs separately.
Okay. So you suggested the Department of Health and they've used AHAC for all, it's almost like 6 programs, PA nurses and nurse faculty, and each one has a repayment and a scholarship element. Is all of that functioning right now through the Department of Health and AHAC, or is it some of this new ideas?
Currently, the Department of Health works with AHAC on loan repayment programs, but works with VSAC on the nurse scholarship program that I referenced earlier. So there's work with VSAC, and we would advocate consistent with the healthcare workforce development strategic plan, that there be if you will, one-stop shop for avenues of financial assistance for persons who are working in the healthcare arena. Recently I've been talking to some students, seniors in the nursing programs, and their understanding of the options that exist today for financial assistance is, it's not entirely clear. I think that the more that we can do to elevate and make clear how persons who are pursuing healthcare careers in the state of Vermont can utilize these resources that are available to them, that is a really important, objective for us. And we also heard routinely that loan repayment is a very significant factor in considering, what the salary will be in an entry-level position out of school. And certainly it is a key expense that these recent graduates have. So again, we really support funding for these loan repayment programs. And I think if we can elevate them, promote them, make it clear that these are avenues that persons can utilize so that they can work and flourish in the state of Vermont in healthcare careers, that's really the objective of the advisory group and the healthcare strategic plan, healthcare workforce strategic plan.
So you're going to get us in writing your testimony or something similar.
Yes.
To, and also this plan that you keep referring to, is that in writing right now as well?
Yes, I can share the full plan with you. And in the materials I prepared today, I also highlighted key sections of that. I provided a summary of the sections and recommendations in the plan and highlighted those as well.
Does the plan highlight, or does the plan talk about these various scholarship and repayment programs and where they should be housed at all? Did you get to that level of granularity in the plan?
We did not get to that level of granularity in the plan about who administers, the program specifically. No.
Okay. All right. Well, that's been very helpful. I appreciate it and sticking with us. We ran over, but thank you very much for joining us. We look forward to receiving your stuff in writing.
I'll send you it right now. Thank you very much.
You're welcome.